Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah, alhamdulillah, wassalatu wassalam ala rasulillah. Rabbi shrah li sadri wa yassir li amri wahlul uqdatan min lisani yafqahu qawli. Inshallah, all of you are well. This is a very brief video after some time to talk briefly about psychosis, of which a type of psychotic illness is commonly known amongst people as schizophrenia. So psychosis is the general term, and somebody can suffer from psychotic disorders. A type of psychotic illness is schizophrenia, which most people are aware about. And essentially, what is psychosis? It's a severe mental disorder in which thought and emotions are so impaired that contact is lost with external reality. And it involves an imbalance of neurotransmitter dopamine. So there's usually an excess of dopamine, which results in this disorder. Psychosis can happen in patients after pregnancy and delivery, postpartum psychosis. It can happen as a result of people using drugs. Particularly, there's a link in the literature with cannabis. So there's a high risk of individuals who smoke cannabis or weed developing a psychotic illness. It is an extremely impairing illness, what we define as a severe mental illness. And some of the symptoms which characterize a psychotic illness include hallucinations. So typically, patients experience auditory hallucinations, which is hearing voices, and these can be of command in nature, commanding them to hurt themselves, commanding them to be violent towards other individuals. Extremely distressing experience. Sometimes they recognize the voices, other times they don't. And because they lack insight, they truly believe that they are hearing these voices and these are real experiences, which causes significant distress. Patients can also experience paranoia. So some patients I've seen, they're convinced that the security services are following them, FBI, CIA, MI5. They may be convinced that their family members are monitoring them, so that they installed cameras in their room and they're monitoring them 24/7. Some patients experience paranoia related to their neighbors, and they're convinced that the neighbors are spying on them. And the key is that when you try and challenge this delusion, so a delusion is defined as a belief which is firmly held and it is unshakable despite evidence to the contrary. So they can believe that if somebody is trying to explain to them, look, this is not something that's real, that they're part of the conspiracy, and the paranoia can be exacerbated. SubhanAllah. Patients may also experience being followed when they're out and about, and they become suspicious. They can experience fluctuations in their mood, experience suicidal thoughts, and engage in self-harming behavior. They may experience what we call ideas of reference. So watching the TV, they may feel that the TV presenter is referring to them. They may have passivity phenomena, which is related to not being in control of their actions. Thought interference, or something called thought insertion, broadcast and withdrawal, where they believe that an external agency is putting thoughts in their head, removing their thoughts, or broadcasting their thoughts. So subhanAllah, it's a very debilitating condition, and it requires early intervention. So the literature shows that the longer you have untreated psychosis, the worse your prognosis. It typically occurs in younger individuals, maybe late teens, early 20s, and like I mentioned, it can be related to a number of different things, but it can also be run in family. So there's a higher risk in family members. So if there's a family history of schizophrenia or psychotic illness, it's important to ascertain that. Now, in terms of treatment is essentially medication. We use antipsychotic medication, different types of antipsychotic medication. What they do is they block the dopamine receptors, and they reduce the psychotic symptoms. Commonly, we have a different range of options, including, for example, olanzapine, haloperidol, risperidone, quetiapine. Broadly speaking, antipsychotics are divided into what we call older typical antipsychotics and then your atypical antipsychotics. They work pretty much in the same way, but it's just the side effect profile which is different. So patients may require hospitalization because of the debilitating nature of the illness, or they can be managed in an outpatient setting. Once their mental state is stabilized, then they will be offered psychological therapy and psychosocial interventions. Subhanallah, there is an overlap in certain cases, which I've discussed in previous podcast episodes with Gabriel Romani about jinn possession. So people who are possessed by jinns can also present similarly to somebody suffering from psychosis, and certainly I have seen cases in which both psychosis and a jinn possession state is involved. So the key message is to be open with your family about any unusual experiences, if they're hearing voices or they're feeling paranoid. If you're worried about their mental state, it's really essential that you seek medical psychiatric intervention as soon as possible, because it's a chronic relapsing remitting disease, and the earlier you treat, the better the prognosis. Inshallah, that was beneficial. Until next time, your brother Dr. Abu Isa. Assalamu alaikum wa rahmatullahi wa barakatuh.